Good day, folks. Thank you for joining us here in Your Health. On today's program, we would like to talk about the health benefits of supplementing your diet with IP6 and Inositol. Well, what is this stuff, Inositol, IP6? This is one of the components of the fiber and grains that provide so many health benefits associated with a high-fiber diet. You can supplement this now and receive those benefits. This is really fascinating stuff. It improves the immune response. It helps the cancer patient. It improves cell signaling, which helps to correct cellular aberrations from just about any type of disease. It's good for you. That's what all that means. First, let's go to our news. Let's see what's happening in the health world. Low-quality diets may increase cancer risk. Researchers from the French National Institute for Health and Medical Research evaluated over 470,000 French citizens' health over 15 years. They found those who consumed the lowest quality diet were 17% more likely to develop cancer. The study was published by PLOS Medicine. Related research from the British Medical Journal finds the regular consumption of fried foods increases the risk of death by about 12% in women. The study followed over 100,000 women for 20 years. Previous research has found 1/3 of all Americans consume fried fast food daily and over 50% eat low-quality foods daily. And finally, from the Center for Disease Control, researchers find up to 90% of all Americans do not eat enough fruits and vegetables. Folks, so many of our health problems have their origins in our daily lifestyle practices. We eat too many low-quality and fried foods, such as fried chicken and fried fish, along with chips, French fries, tacos, and a variety of snack foods, and they taste good, and I understand that. We are eating poor quality foods, plus we are not eating enough high-quality fruits, vegetables, and high-fiber whole foods. Now, these healthy foods help to counter the effect of poor quality foods, but far too many are not eating fruits and vegetables. This low-quality dietary pattern causes metabolic stress that eventually ends in unnecessarily high rates of heart disease, cancer, and other assorted causes of degenerative disease-related misery. It should be good news to all that dietary perfection is not required in order to avoid poor nutrition-related disease. The occasional treat is certainly allowed, but our daily routines must include primarily healthy nutrition. Many health authorities endorse the 90-10 rule to help us plan our dietary patterns. 90% of the time, we eat healthy, fresh, and wholesome real foods, and just 10% is allowed for special occasions and treats. And I think the 90-10 rule is appropriate unless you are struggling with your health. Then you will need near 100% compliance with a healthy diet. When you have attained a pattern of wellness, then you can have the occasional treat. Our studies today confirm this notion, as those who occasionally had fried or low-quality foods showed no increase in disease or death rates whatsoever. But those who made a daily pattern of eating fried and low-quality processed and fast foods, well, they showed distinct patterns of unnecessary suffering. A class of chemicals is associated with weight gain. The class of chemicals called perfluoroalkyls are used to create non-stick cookware, grease and moisture-resistant food wrappers, heat-sensitive receipts, and stain and water-resistant clothing, among many other applications. These ubiquitous chemicals have now been shown for the first time to cause weight gain in humans. Researchers from Harvard followed 621 overweight but dieting subjects. The subjects lost 14 pounds on average over 6 months. They followed the dieters for another 18 months, finding they gained back 6 pounds on average. However, the dieters with the highest blood levels of perfluoroalkyls gained 4.5 pounds more than those with low levels of the non-stick chemicals. They also found those with higher levels of perfluoroalkyls had lower resting metabolic rates, which means they burn fewer calories at rest. The study was published by PLOS Medicine. Related research from York University, published by BMC Obesity, finds the benefits of exercise can outweigh the health risks of obesity. The study found 150 minutes of exercise weekly nearly canceled the health risk of even severe obesity. There is now overwhelming evidence that the chemicals that pollute our environment are at least in part driving our ever-increasing pattern of weight gain. Past research on these perfluoroalkyl nonstick chemicals has associated them with cancer, hormone disruption, high cholesterol levels, and obesity in animals. But this study from Harvard is the first to prove they cause weight gain in humans. They found the dieters with the highest levels of PFAS, as they're often called, gained more weight after a weight loss program. 5 more pounds gained back on average than those dieters with low levels gained. Now you may be thinking, I threw out those nonstick frying pans long ago, so this problem doesn't affect me. Well, I'm sorry, but these chemicals are used in many products, including fast food wrappers and receipts, stain-resistant clothing, and more. In fact, hundreds of tons are produced every year with profits in the billions, so their production is not likely to stop anytime soon. But there is good news from the study from York University. They found just 20 minutes of exercise a day virtually eliminates the health risk of severe obesity. So, until we can clean up our environment, healthy living is our best option for all of these health threats. Today on Your Health, we'd like to discuss one of our very best supplements to help boost your immune system. Today, it's IP6 and Inositol. Stay tuned to learn more.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Do you remember the questions you wanted to ask your doctor after you've left the doctor's office? That's happened to me, so here's my strategy to get ready for a doctor visit. If it's a first-time appointment, be sure your medical records arrive ahead of you. The doctor can review your history quickly. This leaves more time for discussion. For every visit, write down your questions at home. Include a list of medications you take. When you arrive, fill out the medical history forms concisely and accurately. Attach a copy of your questions with the forms so the doctor is aware of your questions before he or she steps into the exam room. Bring a friend for support and have a notepad to take notes. Before you leave, have all your prescriptions. And here's hoping you don't go to the doctor very often. With Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Welcome back, everyone. It's great to be with you today. Today, we're going to be talking about one of my all-time favorite nutrients. It's IP6 and Inositol. You're going to see as we go through the program why this should definitely be what I call a foundational nutrient. That means everyone has it in their supplement plan. This one is amazing. So, Richard, where do we start on this amazing topic?
Well, that's a good way of putting it because the science on Inositol and IP6 is quite complex. But if we labor through this and get to the essence of it, I think you'll see just how powerful these substances are. They truly are remarkable. Inositol and IP6 are related. They're very similar to one another. They're naturally occurring carbohydrate-like substances widely distributed throughout most life forms. So we all have this in us. It was first described by scientists in 1855, meaning we have a lot of information on it. Inositol is a fibrous carbohydrate found in human and animal cell membranes and in some plant cell walls. So it's ubiquitous throughout nature. IP6, or inositol hexaphosphate, is inositol is saturated with phosphate groups. IP6 is found in plant cell walls. Phytic acid is inositol. Phytate is salt form that bonds with phosphates and with calcium or magnesium. Now, this all gets very complicated, but let's keep it simple. When I say inositol or IP6, I am actually describing different things, but they are in essence the same thing because they can be converted back and forth. I want to keep it simple so we don't get bogged down in all these details. The whole point of this is scientists for many, many years now have known that diets high in fiber, high in whole grains, help to prevent disease. They wanted to know what is it in that fiber that helps to prevent disease. And one of the most powerful disease-fighting agents they found in fiber, particularly in whole grain fibers, but in plants as well, is this inositol or IP6. They found they could extract it, and you could amplify the benefit of fiber by taking extra IP6 or inositol. Now, as we go through and discuss this, I'm just going to call all of these different forms inositol and leave it at that, because, as I said, they are convertible back and forth with one another. Inositol plays a major role in dietary fiber's ability to prevent disease and fight cancer, along with improving the immune response. Now, humans are capable of making inositol. We make it in our kidneys and our liver. So it is not foreign to us. This is not a drug, and we really shouldn't study it like we would study a drug. We should study it more from the frame point of physiology. As we age, and if we have health conditions, our ability to make inositol may become compromised. This also occurs with alpha-lipoic acid, CoQ10, a wide variety of substances that are not necessarily vitamins, but as we age or have a health condition, we can't make enough of it, so it becomes what we call a conditionally essential nutrient. The dietary intake in a typical Western diet, an American diet, is from 0.2 grams to 1 gram a day, with most people on the lower side of that. The higher the fiber content of your diet, the more you will ingest, but we're talking about Western diet where 90% are low in fiber. Low fiber, high sugar diets, this is very important, the SAD diet, standard American diet, low in fiber, high in sugar. If you have metabolic syndrome or diabetes, it further depletes inositol levels, compromising our ability to make it. This is some of the new information we have on inositol. If you are a diabetic, if you are a pre-diabetic, if you are overweight, if you eat a high sugar diet, this compromises your body's ability to make inositol and use it effectively. Not just make it, but use it effectively. This means if you are pre-diabetic or a long list of conditions that we'll talk about later on, you really should supplement inositol. Just as Cindy said, foundational supplement for most of us. Inositol can be converted to phosphatidylinositol, and this substance, this is like taking inositol and adding lecithin together. Put those two together, basically. It's not exactly the same, but it's how you can think of it. Put those two together. Our bodies incorporate that into our cellular membranes, and there it acts as a cell messenger. Now, what do I mean by this? If a cell encounters a hostile environment, let's say you have a stomach ulcer or something, or you have a coronary artery plaque in your heart, and your heart's not getting enough oxygen, the cell senses this aberration and it sends a message out trying to correct function. Inositol plays a pivotal role in cell messaging and the self-correcting mechanisms that we all have in our bodies. Without inositol, without proper levels, we can't right the ship. We can't fix the problem. It's that foundational to good health. Are you getting the picture? I hope I explained. Does that make sense to you?
Absolutely.
All right. What else does it do? Not only is it a primary messenger within the cell itself trying to correct that cell's aberrant behavior, it also is involved in sending a message to the next cell. So think of the cells as a colony sending out, we're under attack. Send a message to the neighboring town so they can prepare for the attack. If the inositol levels are low, you don't do that very effectively. So it's the cell, the next cell, the next cell, the next cell. All of these corrective mechanisms are highly dependent on inositol to do this. Myo-inositol is an isomer of inositol. When we talk about isomers, think of all the different types of Ford cars. They're all Fords, but they're a little different, aren't they? They have things in common, but they are different. This is kind of how isomers are. And one of the forms of inositol is a myo. It's called myo-inositol, like muscle, myo-inositol. In fact, it's the most common form of inositol. And inositol in the brain is primarily myo-inositol. It penetrates into the blood barrier, and it is highly involved in neurotransmitter regulation. Our neurotransmitters are how the brain cells communicate, and it regulates our mood, our sleepfulness, our alertness. I feel good about life. I feel bad about life. I find this activity rewarding. I find it distasteful. These are all related to neurotransmitters. And without proper myo-inositol or inositol levels, we don't do that very well. So people who are low in inositol tend to have mental issues. They may be depressed. They may be anxious. They may be fearful. They may be obsessive about certain things. Myo-inositol plays a critical role in our brain's ability to send messages that dictate our mood, our status, our mental state of health. What else? IP6, this is the inositol saturated with phosphates. That is the plant form. That's what we see in the plant cell wall. That is converted to inositol and myo-inositol in our intestinal tract by intestinal bacteria. If our intestinal bacteria is off, we have dysbiosis, that becomes compromised. We do not have enough inositol to do all these things that our body so desperately needs. Inositol was once thought to be an essential B vitamin. Early science showed how important it was, and since it was found in our foods, particularly fibrous foods, particularly whole grains, it must be a vitamin. Well, they determined we can make our own inositol, but again, with age and disease, our ability to make inositol is compromised. Here's our overview. Inositol and IP6 maintain cell integrity, cell transduction, sends signals, DNA repair, ion transport. Cells are like little batteries, and they maintain an electrical charge. Inside and out is slightly different, it's just like a battery. And this is all achieved by conducting ions or particles of a molecule back and forth across that cell membrane. Without inositol, the battery ability of the cell is compromised. That is the spark of life. It is that critical. Now, let's go to our break. And when we return, I want to just mention a few of the specific physiologic functions of inositol.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
Bioinnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
We're back, everyone, learning all about IP6 and inositol, these amazing nutrients. So, Richard, there's some pretty in-depth information here, but it's really important, and you know what? We can get this.
Yeah, stick with me because there's a point to all of this science that is really quite powerful. We talked about the general overview of what inositol does, categorical uses of inositol by our bodies, and this leads to specific functions in the body. Get this is amazing. Cell function regulation, we talked about that, righting the ship, signal transduction, insulin signal transduction. If your body needs to control blood sugar better, inositol is involved in sending the message to make more insulin so we can use that glucose more efficiently. Cytoskeleton assembly, how we form our cells, is dependent on inositol. Nerve guidance. In the developing embryo, if you do not have enough inositol, a developing nerve can't make it a curve. It'll just keep going straight, but there are places in our body where a nerve needs to curve. That's just part of who we are. If you don't have enough inositol, the nerve can't curve. Isn't that amazing? So it just gives you an idea of how important it is to our function. Intracellular calcium control. The calcium level inside of our cells are highly dependent on proper inositol levels. If you don't have the right amount of calcium in your cells, you cannot live. You have all kinds of problems, including high blood pressure, spasm in the muscles, all kinds of things. It's really a mess. Calcium level control is dependent on inositol. Cell membrane potential maintenance, that's that cellular battery we talked about. That membrane potential is how we conduct our nerve impulses, our thoughts. It's just integral to human life and all animal life form is the cell membrane potential. Serotonin activity. Serotonin, our mood neurotransmitters, the breakdown of fats and cholesterol regulation. This is all related to cell signaling. Promotes superoxide production in neutrophils, leading to pathogen destruction. Our white blood cells, when they encounter, let's say, strep throat or staph or some pathogen, salmonella, it engulfs the germ, and then it engulfs inside the white blood cell, the neutrophil, into a little vacuole inside, and it exposes the germ to high levels of peroxide and superoxide, things that destroy the germ. Without inositol, that doesn't happen. It's immunity. That's powerful. Inhibition of cancer cell growth. The recognition of cancer cells is dependent on inositol. The de-differentiation of cells, our stem cells, adult stem cells that are in our body, as they become dead. Let's say I break a hip. The healing process, those adult stem cells have to become hip cells. We don't want it to be a muscle cell. We want it to be the hip joint cell. That's called the differentiation of the cells. It dedicates it to a specific purpose. It's foundational to healing. You don't have to know this to heal, but you can't do it without inositol. Gene expression. All of our genes, you know, we're made up of genes. This is how our bodies function. You can't express these genes of wellness without inositol. Protection from radiation. We have native internal systems to deal with radiation from the sun, from x-rays, from radon, all these things. It doesn't work without inositol. A very powerful antioxidant that prevents the Fenton reaction. What this is iron rusts, right? Anything around iron will rust, including your body. If you have too much iron in your system, it's called hemosiderosis. It is very damaging. It can destroy your liver and your brain and lead to early death. We don't want that. Inositol helps to prevent that from happening. Who knew it did so many things? A lot of this is new information, folks. Every organ requires inositol for proper function. Now, this wide depth of understanding of the role of inositol has led to clinical uses for supplemental inositol. What are we currently using inositol for? For cancer. Support the cancer patient. Not just the epithelial or the carcinomas, epithelial-related cancers, but to support the immune system in the wide variety of cancers, not just the carcinomas. Diabetes. This is inositol is tremendous for diabetes. Remember, when you become diabetic, your inositol ability to function is greatly compromised. Chronic viral conditions. Inositol improves the immune response. Immune suppression from any cause, whether it's chemotherapy or chronic viral infections or poor nutrition, whatever it is, immune suppression. HIV disease, inositol plays a role here. Cardiovascular disease, that's the cell signaling. Blood lipid control actually will lower your cholesterol levels to a more healthier level. Hormone regulation. We will talk in a minute about polycystic ovary syndrome. Inability to conceive due to, for most of them, insulin resistance. Inositol promotes proper ovulation. This goes to hormone regulation, even in polycystic ovary syndrome. Heavy metal chelation. Do you have mercury in your system? Who doesn't? Everybody's got a little. How about lead? Heavy metal exposure is one of the major reasons for our chronic diseases today. Inositol is an excellent chelator of these heavy metals. Psychiatric disorders, remember the serotonin process, the neurotransmitters, anxiety, depression, bulimia, panic attacks, obsessive compulsive disorders, and agoraphobia, fear of interaction with humans. You know, these are people who haven't left their house in 20 years. They might benefit from higher dose inositol therapies. This is all the different uses we're using inositol today. And you can get this over the counter. It's a dietary supplement. It comes from the fibrous content of our diet. It's an outstanding advancement of science. Well, we have thousands of complex scientific writings clarifying inositol's role in physiology. And I have to say this, I've been studying science all my life, and I have to tell you, reading about inositol has challenged my abilities to understand science. It really has. It's amazingly complex. Imagine the biggest city on the planet with all the intricacies, all the interactions of humans, all the services, all the things that go on in a city. One single cell in the human body or any living thing makes a city look simple. It is so complex, and inositol is at the very essence of the life thread. And as we get older, as we have disease, our ability to use inositol is greatly compromised, but we have a remedy for that we want to talk about when we return. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Do you take medication every day without noticing any side effects? Well, new research finds that many of our most popular medicines, when taken over a long period, rob our bodies of precious nutrients. For example, statin drugs for cholesterol deplete CoQ10. Acid-blocking drugs, such as the proton pump inhibitors, lower magnesium and vitamin B12. Gabapentin for seizures and chronic pain depletes vitamin D. And hydrocodone, a narcotic for pain, lowers melatonin levels, which can disturb sleep. These are all top 10 medicines in America. If you are taking a daily prescription medicine, talk with your doctor about a vitamin and mineral deficiency as a side effect. For Your Health at a Glance, I'm Dr. Richard Becker. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
Bioinnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. We're back, everyone, discussing the amazing benefits of IP6 and inositol. And to help you get this in your medicine cabinet, we have a great special today. Dr. Becker's Bionutrients IP6 and inositol is buy one, get one free. You buy one bottle at the regular price, and you're going to get a second bottle free. Okay, Richard, there's some amazing research behind this amazing nutrient. So let's get into that.
How can we use inositol to improve our health? When we ingest inositol, when we take it by mouth, there is near complete absorption and distribution throughout all tissues, including the brain. We know when you take it, it's worth taking it because it's absorbed by our body and it goes throughout our body. So we know that for a fact. It has dose-dependent, synergistic anti-cancer activity. It's more effective when extracted and taken as a supplement than with the fiber in their natural forms. And we're talking specifically now about cancer. this topic of cancer. This is a major concern, and a major use of inositol is in the cancer patient. You remember, digestion is often compromised in the cancer patient. They take chemotherapy and radiation agents that make you quite nauseous and maybe even make you vomit. And I don't want to eat anything, I feel terrible. You know, you've heard this, you've seen this. And if you take the pill, the capsule form of inositol, it is more effective than trying to get it completely from your diet. They've been able to prove that. Memorial Sloan Kettering reports that IP6 is used to prevent and treat cancer via its cell signaling ability, useful in alleviating the side effects of cancer therapy, such as chemotherapy or radiation, and it does improve the quality of life in cancer patients. This is Sloan Memorial Kettering. You know, they're one of the most trusted names in cancer therapy worldwide. People come from all over the world to go to that hospital to get cancer help. Now, I do want to say that the FDA has not approved inositol as a treatment for cancer. This is nutritional support for the cancer patient and other conditions. Nutritional support. That's how we have to think of it. Multiple studies now have shown IP6 as inositol's ability to transform cancerous cells back to healthy cells. You know how? Through cell signaling, helps to right the ship of the ailing cell. It initiates apoptosis, or programs cell death of these abnormal cells. And it helps to prevent the formation of blood vessels into the tumor. See, a tumor needs nutrition to survive, and it gets that through the blood flow. A new blood vessel is formed to support the tumor. Well, inositol helps to prevent it from making a blood vessel. It's called anti-angiogenesis. It also improves the response to chemo. Chemo is more effective. Perhaps we can use lower doses. And it reduces the side effects of cancer therapies. In test tube studies, they've been able to determine that esophageal, pancreatic cancer, melanoma, breast and colon cancer, primarily the carcinoma lines. Carcinoma, these are cancers of the epithelial, the surface cells. These are the worst ones. Now, any cancer is bad, don't get me wrong, but breast cancer, colon cancer, lung cancer, pancreatic cancer, the carcinomas are among the most difficult to treat. They have that reputation. And this is where inositol shines the brightest, is in the treatment of the carcinomas. However, it is also helpful for other forms of cancer due to its ability to boost the immune response. University of Maryland says the inositol inhibits the growth and destroys breast cancer cells. Adding inositol to breast cancer chemotherapy makes the treatment more effective. Cancer research, inositol and IP6 stalls progression of large granular lymphocytic leukemia. And there's so much more. We don't have time to go into all the different studies, but cancer research, this is a journal, animal model of prostate cancer. IP6 inhibits prostate cancer. Then the mechanism is explained. They know how it works. IP6 is more effective chelator of radioactive uranium than standard treatment. This goes to countering the radiation side effects used in cancer treatment. Nutrition in cancer, IP6 possesses the ability to enhance immune function, act as a natural antioxidant, prevents calcification and kidney stone formation, lowers cholesterol levels, and reduces elevated platelet activity, which prevent clotting is a big problem in cancer treatment. IP6 inositol helps to prevent these clots that occur with cancer. The first International Symposium on Disease Prevention, a big organization, reveals, they state there's now considerable evidence supplementing with inositol and IP6 improves outcomes in the carcinomas and acts as a good supplement to other cancers to counter immune suppression. That should be enough for anyone to say, I can do this comfortably, especially when you realize we all have inositol in our bodies. It's in our diet. It's not a drug. It doesn't interact with any known medicine. It is an excellent supplement for the cancer patient. Can we leave it there? Excellent supplement. I took it every day when I was in cancer therapy, and I credit it in my lymphoma as one of the reasons I'm here still today. I can't give it a higher endorsement for the cancer patient. Next, diabetes. Diabetes damages our ability to make and absorb and the effectiveness of our natural inositol. Diabetics, please pay attention. You will be able to make more insulin. Your insulin will work more effectively if you supplement inositol. It will also help to prevent the complications of diabetes. This has all been studied in good quality controlled studies and in human studies. Let's go to our break because I do not want to short the diabetic the benefits of inositol. We'll do that next. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today. Here is our hope for you today. I'm Cindy Becker. Do you feel that you'll never really be joyful and happy in your life? The Reverend Billy Graham wrote about these two emotions, joy and happiness. Dr. Graham says, joy is not the same as happiness, although they may overlap. Happiness depends on circumstances. Joy depends on God. In Psalm 30, David, whose life seemed an endless battle, experienced joy despite his problems as king of Israel. David wrote, "You turned my wailing into dancing. You removed my sackcloth and clothed me with joy, that my heart may sing to you and not be silent." If you are struggling to find joy in your life, pray to God. Count your blessings. Joy depends on God. I'm Cindy Becker. This is our hope for you today.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone. I just want to give you a little reminder. We have a great special today that can help you get the IP6 and inositol in your medicine cabinet. We have Dr. Becker's Bionutrients IP6 and inositol. Buy one, get one free. Buy one bottle at the regular price. You get a second bottle free, so don't miss it. So, Richard, this next section is so important. The diabetics suffer so much.
Remember, with diabetes, our ability to use our innate inositol is greatly compromised. So here's a study, and there have been multiple of these. This is just one of them, a double-blind, placebo-controlled, 40 diabetic patients, improved glucose levels, 14% lower glucose levels, decreased insulin level. We have insulin resistance in type 2 diabetes, decreased insulin resistance, improved beta cell function. The pancreas works better for the diabetic. The blood fats, the lipids, the cholesterol, the triglycerides, all reduced, and the HDL increased. These are all good things. They all benefit to the diabetic. Next subject, menopause. You know, with menopause, a woman's risk of cardiovascular disease becomes higher than a man's. Yeah, it's serious business. And inositol, if we supplement at menopause, we help to decrease the cholesterol, triglycerides, and the blood pressure while increasing HDL. This will all decrease your risk of cardiovascular disease, ladies. Next, healthy, non-obese pregnant women. Inositol, folic acid, and manganese reduce their cholesterol levels, triglyceride, glucose levels. Promising early evidence of inositol and IP6 benefit in calcifying disorders. This is hardening of the arteries, kidney and gallstones, osteoporosis, aberrations of calcium metabolism benefit nicely from inositol. Pay attention. Gestational diabetes, reduced risk of gestational diabetes. There's diabetes during pregnancy. We don't want that. It's bad news. Reduced insulin use, more likely to carry to term, smaller babies. The diabetic mother has obese babies. A 10-pound baby is hard to deliver. Higher incident of C-section. We want to reduce C-sections, not increase them. So diabetic mothers, if you take inositol, the baby size is normal. Pretty amazing. Smaller babies, which is a good thing in this setting. We don't want a large baby in the diabetic mother. Fewer episodes of neonatal hypoglycemia. Here's a new area of research, neonatal respiratory distress. And these are babies that are born too small. Their lungs are not mature. If we give those babies inositol, they do well. Steroid-free. That's the standard treatment for that respiratory distress of a small infant. Inositol works. See, it's even safe for babies. It's in everybody, so it's good to do. PDR for nutritional supplements. Physician's desk reference for nutritional supplements. Inositol contains myo-inositol, which is brain active, can be helpful for Alzheimer's and Parkinson's disease, obsessive compulsive disorder, panic attacks, agoraphobia, bulimia, unipolar depression, that's standard depression, stress, anxiety, and trichotillomania. What is that? Trichotillomania is where we obsessively pull our hair out. It's a mental disorder, and taking higher doses of inositol helps to control these behaviors. You know, folks, the medications we use for these conditions, they're woefully inadequate. I'm not saying you should never take those medicines. They have their place. But you can take inositol with them, and you're going to make better progress for most of them, along with a complete nutritional plan, holistic approach, always. Be sure you have inositol. Some of these mental health issues are completely disabling. You know that. If you have a loved one with this, you know how disabling it can be. Think outside of the box. There's so much research on this now. It's safe. What else? Let's see. Here. Immunity. Okay, you don't have cancer. You don't have mental illness, but you're getting sick. Every month there's a new cold, one thing after the other, and you're sick of it. Inositol IP6 increases natural killer cell activity by about 60%. When natural killer cells, their function is improved by 60%, it improves your adaptive immune system, which is basically bacteria, and your innate immune system, which is cancer, viruses, and fungi. This, in turn, affects all arms of the immune response, 60% improved response. So if we're on a good nutritional program and we add inositol and good healthy living, your immune system is going to dramatically improve for the vast majority. A little vitamin C, a little zinc, a little B vitamins. Well, don't forget your vitamin D, you know, and then inositol. Probiotics, do the whole, everything you've learned on this program. You're going to have fewer and fewer colds. You may even go the whole year without flu this year. It's pretty amazing what can happen when we do it this way. Before the break, this is very important. Polycystic ovary syndrome. This is one of our leading causes of infertility in America today. It is associated with obesity and too much androgen or testosterone-like hormones in our system and not enough estrogens. But not always. But there's an underlying theme of this, PCOS and inositol. Over 70 studies now confirm, ladies, you're more likely to ovulate and conceive if you include inositol in your fertility plan. Cell signaling, right the ship. The struggling cell needs help. Help it with inositol. Hormone regulation. See, it all makes sense when you take the time to study that science, then you can apply it clinically, as it were. Also, one of the new trends is understanding how it helps male infertility. So, women and men both, inositol and fertility. When we return, we'll talk about who should take it and how much should they take in just a minute. CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
Bioinnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At Bioinnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by Bioinnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder, we have the IP6 and inositol. Buy one, get one free today, so don't miss it. So, Richard, who should consider adding IP6 and inositol to their supplement plan?
Any cancer patient, primarily carcinoma patients, but even the lymphomas, the sarcomas, all the various types of cancer, inositol can be helpful to help support your immune system. I use it in my supplement package for lymphoma, and I considered it foundational, and you should too. please consider inositol if you're a cancer patient. Any type of immune support or modulation, whether it's a hyperactive immune system or a deficient immune system, inositol can play a role. Radiation exposure in cancer, or let's say you have chronic spine pain and you have to take CT scans a lot, and you want to protect your body. That's a smart thing to do. The doctors won't do that for you. You'll have to do it on your own. Take some inositol before you go in for that study. You'll have less radiation damage. That's the kind of thing I'm talking about. Chronic viral conditions, Epstein-Barr virus, hepatitis C, HIV, herpes simplex, any chronic viral condition, diabetes and all its complications, polycystic ovary syndrome, or infertility of any type, cholesterol problems, peripheral vascular disease, weight loss purposes, liver problems, fatty liver disease, it plays a role here, constipation, remember it is a fibrous agent, you know, it comes from fiber, it makes sense, heavy metal chelator, especially uranium, it works better for uranium detoxification than the standard treatment on the market today. Interesting to know. Autoimmune disease, depression, anxiety, obsessive compulsive disorder, the dementias, there is some help there for the dementia patients. I don't want to portray it as a cure for Alzheimer's, it's not, but it does help to set the cells right again. That's the whole concept behind it. Here's one that we didn't have a chance to talk about, I want to mention. If you have chronically low sodium levels, hyponatremia, low sodium, it can leave you prone to low blood pressure, confusion, disorientation. It can be a real problem. Try some inositol. It may change your life. This is one of the niche uses of inositol. Now, how do we take this? And you can also just use inositol as a daily tonic to help keep you strong. There's a place for this. Or if you have a diet that's low in fiber and you just, boy, I'm on the go a lot, I can't eat properly, take a little inositol. Your body needs it. It does a person good. Now, inositol capsules, 2 capsules of what Cindy has for you provides you with 800 milligrams of IP6 and 220 milligrams of inositol. And remember, the IP6 is interchangeable by the intestinal bacteria into inositol, which is primary myo-inositol. It's all interchangeable. What we do with this preparation is the IP6, we attach magnesium and calcium ions so it does not deplete the body of these essential minerals. There has never been a recorded case of anybody having depletion of essential minerals from supplementing inositol. This only occurs in native states where people are starving anywhere and they're not supplementing. They're eating a high fiber diet with nothing else in their diet. But that is an old admonishment about inositol that has now been proven false. You don't have to worry about it. You can take up to 6 capsules a day. That's a very typical dose. And if you're fighting for your life or have profound mental illness, 12, 18 capsules a day and even higher has been studied and shown to be safe. Inositol, one of the most important supplements available today. Thank you for your kind attention. We'll see you here tomorrow on Your Health.
Thanks, everyone. Bye-bye.
Hello, I'm Bill Malone of Christian Television Network's Play and Giving Department. Did you know that a will is one of the most important documents that you will ever sign? Yet a majority of Americans die each year with no will, and so the government receives a large percentage of their estate in taxes and fees. We can help you eliminate this loss with our free Guide to Wills and Trusts booklet. Call the number on your screen or go to our website for further information. Your long-range plans deserve special attention.
Join Jim and Lori Baker every day as they welcome anointed teachers.
The result of our prayers will determine the future of our nation.
And the most dynamic personalities from around the world as we share grace and restoration.